Okay, so we are going to have a walkthrough of H 237 with Ledge Council, and then at 11:15 we'll come back and hear from the reporter of the bill. So we'll do it reverse order this time, but we're still doing it. Go ahead.
Great.
Katie, thanks.
Still Katie McLean, Office of Legislative Counsel. The previous bill that we looked at has already passed through the House. This bill is still moving through the House. It's up for third reading this afternoon. There were no questions on the floor yesterday evening. And so the document you have, this draft 1.3, is the Healthcare Committee report. Ways and Means had a one-word amendment that was accepted yesterday, and I will show you where that is when we get to it. So the concept behind this bill is that we already, the state of Vermont, already licenses psychologists, and this recognizes that there could be a specialty, like sort of a specialty endorsement added on to the licensure for psychologists. For doctoral level psychologists when certain criteria and circumstances are met.
Hold on a second.
Sure.
Katie. We've got these paper copies that are,
The pagination.
the pagination is switched.
Yeah.
Oh, 3 and 4 are at the end. Okay.
Yeah.
Are you, what are,
We
is
have-
that the bill is introduced?
Yes.
Okay,
Yeah.
so that will be a little bit different than
Okay.
what
We'll
passed
wait.
out with the committee.
We'll wait.
Lucky here.
Yeah.
Maybe, I mean, there'll be lots of similarities, but I don't think they'll
Okay.
track each other
All right.
very
We'll
well.
hold our thought.
Okay. So first, within the existing chapter on psychologists, there is already a definition section. So we're adding to the definition section. A collaborating practitioner is one of the terms. It means a physician licensed to practice who has a specialty in psychiatry. And you'll understand as we go through the bill that a prescribing doctoral level psychologist has to work with a collaborating practitioner. DSM means the Diagnostic and Statistical Manual of Mental Health Disorders. Drug cross-references an existing statute in this title 26. Prescribing psychologist means a licensed doctoral level psychologist has undergone specialized training, has passed an examination as determined by rule, and has received a current prescribing specialty that we'll look at under this new section 319 that's being added to the chapter. And that specialty hasn't been revoked or suspended. Again, prescription drug, we're cross-referencing to existing statute. And then prescriptive authority means the authority to prescribe or discontinue prescription drugs solely for the purpose of diagnosing, treating, or managing a condition recognized in the DSM. Prescriptive authority excludes the authority to dispense, administer, or distribute prescription drugs and prescribe or discontinue prescription drugs for patients who are less than 18 years of age, over 80 years of age, or pregnant. Okay. So that's the definition section. And then in the same chapter, there is a section about the Board of Psychological Examiners. And basically this section is a rulemaking section, what the board has the authority to adopt rules on. And this is being amended so that they are playing a role in sort of the parameters around what a prescribing psychologist would do. So the board is to adopt rules necessary to perform its duties under this chapter, including rule that, and you'll see that we're striking subdivision 2, explain complaint and appeal procedures to licensees, applicants, and the public. And we're adding some new items, regulate prescribing psychologist licensees pursuant to section 3019 of this title, including the setting of clinical rotations and prescriptive authority, including designation of conditions and drugs excluded from that authority, as well as requirements for the prescribing of particular drugs. And in subdivision 4, replacing explain how the board shall investigate suspected unprofessional conduct with regulate collaborative practice agreements that are set forth in 3019, including collaborating practitioner qualifications and annual competency evaluations. So that is it for the rulemaking. And then we get to this section that has been cross-referenced a few times, section 3019. So this is a new section that would be added to the end of the existing chapter on the licensure of psychologists. And this is creating that new specialty. So in subsection A, a psychologist doctorate may apply to the board for prescribing psychologist specialty. The application is to be made in a manner approved by the board and include the payment of any required fees. This word "any" is important, and the only change that Ways and Means made is to change the next reference to required fees from the required fees to any required fees. So there'll be some conformity there. If you are not aware, there's a bill that is moving through the House right now. It was also up for second reading yesterday. And that created a fee for all specialties, not just prescribing psychologists, but were both bills to pass, that would apply here. So that's why there's language about any required fees, because we don't know if that would pass, but that is what is moving right now. And that's how those two pieces fit together. In subsection B, we have language about the examination. The psychologist doctorate is to be eligible for prescribing specialty if that individual holds a current license to practice psychology at the doctoral level in the state, has successfully completed a postdoctoral training program in psychopharmacology designated by the American Psychological Association or its successor. The person has completed clinical rotations over a total of not less than 14 months and not less than 9 practice settings, to include psychiatry, pediatrics, geriatrics, family medicine, internal medicine, emergency medicine, obstetrics and gynecology, surgery, and 1 elective. The person has completed a national certifying exam as determined by rule and meets all the other requirements for obtaining the specialty as determined by rule. So there's a little bit of leeway there for the board to create additional parameters in rule for what criteria would need to be met to become a prescribing doctoral level psychologist. In subsection C, we have the criteria for prescribing medication. There would have to be a written collaborative agreement that is required between the prescribing psychologist who is working under the specialty and the collaborating practitioner. That's the physician that they would be working with. The issuance of prescriptive authority by a collaborating practitioner to the prescribing psychologist is only to include prescription drugs for the treatment of mental health conditions that the collaborating practitioner generally provides to patients in the normal course of practice. The collaborating practitioner is to file the collaborative agreement with the board and any notice of termination of that agreement with the board, and issuance of prescribing authority for Schedule 2 through 5 controlled substances are to include or to identify a specific substance by brand or generic name. Prescription or administration of a controlled substance by injection would be allowed under this collaborating agreement. And then we have language in subsection D about individuals and a sort of waiving in without the exam. So the director of the board may, upon payment of any, on line 18, that's where the change is, any required fee, grant a prescribing specialty without examination if the applicant holds active psychologist prescribing authority in another U.S. or Canadian jurisdiction, and the requirement for the psychologist prescribing authority in that jurisdiction and the judgment of the director are substantially equivalent to what's in this section. In terms of effective dates, we have the act itself taking effect July 1, 26. The act itself taking effect July 1, 25. And section 2 is taking effect July 1, 25. That is the authority for the board to go through rulemaking. And then everything else takes effect July 1, 26. So the idea is that gives the board a year to put the rules in place, and then this would take effect the following year.
Yeah, rules sometimes take a long time. As we know. Go ahead.
Thank you. How many other states do this? I'm just curious.
Oh, gosh, I don't have that.
This will be a good question to ask.
This is
I know.
a
Yeah. hold
great
on.
here. You should know that's okay. I wish
Yeah.
I knew it.
Yeah,
Oh, you have an answer now.
yeah, we'll figure it out. We'll get folks in and testify. And actually, Representative Fawn might know
Okay.
the answer to that. Great. Any other questions for Katie? Okay. So let's take, we'll go off live for now and come back.